Hello, I'm Gloria Hall, Editor-in-Chief of Chiropractic Economics. I'm here today with Dr. Erin Stubblefield, author of the article Building Retail Revenue Without a Compliance Crisis. Dr. Erin, welcome.
Thank you for having me.
Of course. Before we get started, can you tell us a little bit about your background and your work with KMC University?
Absolutely. So I've been in the chiropractic profession for 20 years this year, as a matter of fact.
Congratulations.
And thank you. After graduation, I practiced privately in Illinois and for about 4 years. And then I was given the opportunity to teach, which has always been a passion. I come from a family of teachers. So to be able to teach chiropractic education was really an awesome step for me in my career. So I transitioned to higher education and I was there taught for about 14 years. I still do some adjunct work for a couple of schools in New York, which has been really a blast. And decided that when I transitioned out of higher education in 2023, that I still wanted to be deeply involved in chiropractic, and compliance was a natural step for me. I'm very much procedurally oriented. I like to figure out the how and the why behind why we do what we do as a profession. And so it was a natural segue to compliance. And so I've had a relationship with KMC University for a decade prior, and had some conversations with their leadership. And it seemed like a great fit for me to move into an education specialist role because of my work in higher education. So I've been building our education platforms for the colleges, and it's been a great transition in my career.
Very interesting. Thank you.
Yeah.
So we'll get started with some questions. So there is a massive movement right now toward diversifying income and moving to cash services. Why is a compliance forward mindset so critical?
It is moving towards cash practices is really big right now. And it's this shift happening where practitioners are looking for ways to stabilize their business models outside of traditional insurance reimbursement. It's really exciting. But the reason is to have a compliance forward mindset. It's so critical because cash doesn't mean unregulated. And that's what a lot of doctors get the misinformation. Well, I'm taking cash, so like I don't have insurance companies, barking down my door. But even if we're selling, retail products or having a heavy cash forward practice, we're still operating within this healthcare landscape. So I like to remind doctors that we're perfectly positioned for this self-care movement happening in the US right now, where people are increasingly prioritizing their own well-being. And so by offering topicals, ergonomic tools, we aren't just selling stuff. We're giving patients the agency to manage their health in between visits. And if we don't have clear boundaries between our clinical services and our retail sales, we can accidentally trigger things like the Anti-Kickback Statute. So my goal is to always help doctors embrace this movement in a way that builds a resilient business that can withstand an audit, because even cash-heavy businesses are still under the banner of regulatory audits.
All right. So you mentioned the anti-kickback statute as a major concern. Could you explain in more detail how it ties to federal funding and what the actual limits are for gifts or incentives?
Yeah, the Anti-Kickback Statute, or I'll call it AKS. It's a federal statute that prohibits what the law calls remuneration. So in plain English, it means that you can't give anything of value. So not just cash, but we can't give products or anything of value to the patient if the goal of giving them that thing is to get them to use a service that's paid for by a federal program like Medicare or Medicaid. So most doctors want to know if they can give anything away. The Office of the Inspector General, who is the big entity that governs these federal programs, specifically the CMS, which is Centers for Medicaid and Medicare Services, they do have what's called a nominal value threshold. So right now you can generally provide a gift or incentive to a federal beneficiary as long as it's not more than $15 per item or $75 in the aggregate per year per patient. It's important for doctors to just be careful because of the other part of AKS, which is the one purpose rule. This rule states that if even one reason that we're giving a $10 gift was to induce the referral for reimbursed services, it can still be viewed as a violation. So the law doesn't care if your heart is in the right place. It's the inducement that, if the inducement is present, that's where your risk lies. So this is why I always advocate for really total transparency and keeping your retail sales completely separate from your clinical billing to avoid any issues with the anti-kickback statute.
Okay, excellent. So for a doctor just starting with retail, what are some of the lowest overhead options you could recommend?
I usually suggest starting with things that naturally extend the care that the doctor is already providing. So think about supportive equipment like foam rollers or ergonomic pillows, things you're likely already recommending during treatment. Topical pain relievers, high quality supplements are also really, really fantastic because they feed into this empowering patients to manage their self-care at home as part of that self-care movement. And it's also a great opportunity to include branded merchandise. So when a patient uses a water bottle or wears a t-shirt that has your clinic logo, they transition from a patient to a brand advocate. It generates revenue while providing essentially free marketing for your practice. And if you want to, doctors even want to drop lower on their overhead, they can consider paid in-office workshops on posture or nutrition. We work with an office in Minnesota, and she does in-office presentations for couples, for migraine headache sufferers. And they're paid. They come in, they get a little goodie bag of topical pain relieving cream, some snacks that are shown to help with foods that are designed to help migraine headaches. And then she shows the partners some massage therapy techniques and some acupressure techniques to help relieve some of the pain. So it's a great way to get people into the office. There's no cost for her because she owns the building, and she's able to brand some of the merchandise then that people take out into the community. So it's a great way to earn income without putting out a lot in overhead. So you're not managing physical inventory, you're simply leveraging your expertise for these in-office presentations.
Okay, excellent. So in your article, you emphasize fair market value. How should a practice determine this to stay safe?
Well, consistency is the best rule of thumb when it comes to fair market value. Fair market value means that you're selling the product at a price that would be reasonable for anyone, whether they're a patient or a member of the general public. So things to consider, like the Stark Law, for example, is a secondary concern for standalone chiropractors. Integrated practices that have medical doctors or doctors, DOs, have to be vigilant too. So if you're in a hybrid practice model, you have to be really careful about how you price, and that your referrals are for designated health services like labs or imaging, so that we don't run the risk of that self-referral law, which is our Stark Law. For anyone else, just keeping our pricing transparent and consistent with what similar products sell for in a standard retail environment.
All right, excellent. If a practitioner's current setup is a bit messy, what is the first step they should take?
Well, the first step is really to stop commingling your transactions. Start treating retail and clinical as two completely separate worlds with separate invoices. A lot of doctors don't realize that the OIG, the Office of the Inspector General, actually has a roadmap specifically for small physician practices. So one easy win for compliance is to simply designate someone, even if it's the primary doctor in the office, as the compliance officer, which sounds really formal, but it's just somebody committing to written policies and regular internal audits to check for any errors. Combining that with consultations with a healthcare attorney is the best way to ensure that your clinical billing is separate and compliant and your retail revenue is separate and compliant.
Dr. Erin, thank you so much. This was wonderful. A nice compliment to your article. Thank you for all you do for the profession, and thank you for being a contributor to Chiropractic Economics.
I am very grateful to be able to contribute to the stellar reputation of this magazine, and I'm grateful for your time.
Oh, thank you. You have a great day.
You as well.